Hi everyone and welcome to my channel hube tabibi. This video of mine is about gallbladder cancer, which is an abnormal growth of cells that begins in the gallbladder. Earlier I posted a short video about gallbladder cancer on this channel. I hope you have already seen that video, and today I am going to discuss this cancer in detail. Well, your gallbladder is a small pear-shaped organ on the right side of your abdomen, just beneath your liver. The gallbladder stores bile, which is a digestive fluid produced by your liver. Gallbladder cancer is uncommon. When gallbladder cancer is discovered at its earliest stages, the chance for a cure is very good, but most gallbladder cancers are discovered at a late stage when the prognosis is often very poor. Gallbladder cancers may not be discovered until it is advanced because it often causes no specific signs or symptoms. Also, the relatively hidden nature of the gallbladder makes it easier for gallbladder cancer to grow without being detected. Now I will tell you the symptoms. Gallbladder cancer signs and symptoms may include abdominal pain, particularly in the upper right portion of the abdomen, abdominal bloating, losing weight without trying, yellowing of the skin, and whites of the eye, which is known as jaundice. You should make an appointment with your doctor if you experience any signs or symptoms that worry you. Okay? Now I will tell you about the causes. It is not clear what causes gallbladder cancer. Doctors know that gallbladder cancer forms when healthy gallbladder cells develop changes which are known as mutations in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The changes tell the cells to grow out of control and to continue living when other cells would normally die. The accumulating cells form a tumor that can grow beyond the gallbladder and spread to other areas of the body. Most gallbladder cancer begins in the glandular cells that line the inner surface of the gallbladder. Gallbladder cancer that begins in this type of cell is called adenocarcinoma. The term refers to the way the cancer cells appear when examined under a microscope. Now I will tell you about the risk factors. Factors that can increase the risk of gallbladder cancer include your sex. Gallbladder cancer is more common in women. Your age. Your risk of gallbladder cancer increases as you age. A history of gallstones. Gallbladder cancer is most common in people who have gallstones or who have had gallstones in the past. Well, earlier on this channel of mine, I have posted a video about cholecystitis, which is mostly due to gallstones. You can watch that video, which is available on this channel. Okay. And the larger gallstones may carry a larger risk. Still, gallstones are very common, and even in the people with this condition, gallbladder cancer is very rare. Another risk factor is that if there are other gallbladder diseases and conditions that can increase the risk of gallbladder cancer. These conditions include polyps, chronic inflammation, and infection. Also, inflammation of the bile ducts is another risk factor. Primary sclerosing cholangitis, which causes inflammation of the ducts that drain bile from the gallbladder and liver, increases the risk of gallbladder cancer. Now I will tell you about the diagnosis of gallbladder cancer. Tests and procedures used to diagnose gallbladder cancer include blood tests. Blood tests to evaluate your liver function may help your doctor determine what is causing your signs and symptoms. Patients may come with us with the symptoms of jaundice, as I told you earlier, so we can carry out liver function tests. Okay. Then we may order procedures to create images of the gallbladder. Imaging tests that can create pictures of the gallbladder include ultrasound, computerized tomography, that is CT scan, and magnetic resonance imaging, that is MRI. Okay. Basically, the purpose of these tests is to determine the extent of gallbladder cancer. Once your doctor diagnoses your gallbladder cancer, he or she works to find the extent, that is the stage of your cancer. Your gallbladder cancer stage helps determine your prognosis and your treatment options. Tests and procedures used to stage gallbladder cancer include exploratory surgery. Your doctor may recommend surgery to look inside your abdomen for signs that gallbladder cancer has spread. In a procedure called laparoscopy, the surgeon makes a small incision in your abdomen and inserts a tiny camera. The camera allows the surgeon to examine organs surrounding your gallbladder for signs that the cancer has spread. Test to examine the bile ducts. Your doctor may recommend procedure to inject dye into the bile ducts. This is followed by an imaging test that records where the dye goes. These tests can show blockages in the bile ducts. These tests may include magnetic resonance cholangiography and endoscope retrograde cholangiopancreatography, that is ERCP. Additional imaging tests. Most people with gallbladder cancers will undergo a series of scans to help determine whether the cancer has spread or remained localized. When scans should be performed vary depending on your circumstances. Common scans include a CT and MRI scan of the abdomen and chest. Your doctor uses information from those procedures to assign your cancer a stage. The stages of gallbladder cancer range from 0 to 4. The earliest stage indicates a cancer that is confined to the gallbladder. Later stages include more advanced cancer that has grown to involve nearby organs or has spread to other areas of the body. Now I will tell you about the treatment of gallbladder cancer. What gallbladder cancer treatment options are available to you will depend on the stage of your cancer, your overall health, and your preferences. The initial goal of treatment is to remove the gallbladder cancer, but when that is not possible, other therapies may help control the spread of the disease and keep you as comfortable as possible. And the first treatment is surgery for early stage gallbladder cancer. Surgery may be an option if you have an early stage gallbladder cancer. Options include surgery to remove the gallbladder. Early gallbladder cancer that is confined to the gallbladder is treated with an operation to remove the gallbladder, which is known as cholecystectomy. Surgery to remove the gallbladder and a portion of the liver. Gallbladder cancer that extends beyond the gallbladder and into the liver is sometimes treated with surgery to remove the gallbladder as well as portion of the liver and bile ducts that surround the gallbladder. If your gallbladder cancer is very small and can be removed completely with cholecystectomy, you may not need additional treatments. If there is a risk that cancer cells may remain after surgery, your doctor may recommend chemotherapy or other treatments. Chemotherapy. Chemotherapy uses drugs to kill rapidly growing cells, including cancer cells. Chemotherapy can be administered through a vein in your arm, in pill form, or both. Chemotherapy might be recommended after surgery if there is a risk that some gallbladder cancer cells might remain. It can also be used to control the cancer if surgery is not an option. Radiation therapy. Radiation therapy uses high-powered beams of energy such as X-rays and protons to kill cancer cells. The energy beams come from a machine that moves around you as you lie on a table. Radiation therapy is sometimes combined with chemotherapy after surgery for gallbladder cancer if the cancer could not be removed completely. Radiation therapy can also control gallbladder cancer that is causing pain if surgery is not an option. Another treatment option is targeted drug therapy. Targeted drug treatments focus on specific weaknesses which are present within cancer cells. By blocking these weaknesses, targeted drug treatments can cause cancer cells to die. Targeted drugs might be an option for people with advanced gallbladder cancer. Your doctor may test your cancer cells to see which targeted drugs are most likely to work for you. Immunotherapy. Immunotherapy is a drug treatment that helps your immune system to fight cancer, which is your body's disease-fighting immune system. Your body's disease-fighting immune system might not attack cancer because the cancer cells produce proteins that make it hard for the immune system cells to recognize the cancer cells as dangerous. Immunotherapy works by interfering with that process. Immunotherapy might be an option for treating advanced gallbladder cancer. This was my video about gallbladder cancer. I hope you like this video. If you are suffering from any gallbladder problem, you can comment in the comment section of this video. On my channel tabibi, I have uploaded more than 300 medical videos. And if you are suffering from any illness and you cannot find a particular video about your illness, you can ask me in the comment section and I will try to make a video about your condition as soon as possible. And if I do not find a time, I'll try to reply to your comment, because I usually reply to almost all comments on my channel as soon as possible. Thanks for watching this video, and see you in next video. Bye for now.